All right. Well, I think we might make a start. We've had a few more people in this register, but hopefully people will come along as the session begins. Thank you all for coming along today to this first information session for our new study, Workers' Voice. It's great that you've been able to join us today. My name is Alex Collie. I'm a professor in the School of Public Health and Preventive Medicine at Monash University. Before I begin, I'd like to do an acknowledgement to country and just acknowledge that I'm coming to you from the lands of the Wurundjeri people of the Kulin Nation and pay my respects to elders past and present, and also my respects to the people of the Indigenous nations from wherever you may be joining us from today. What we're going to do today is just provide a high-level overview of this new project Workers' Voice, and then have any questions, answer any questions that you may have. If you'd like to ask some questions along the way, please pop them in the chat. That way we'll have a record of them and we'll be able to address them one at a time as we go. We're going to ask you to do something first, which is just to tell us a bit about where you're coming from towards this study. So are you a person who's had a workers' compensation claim? Are you someone who has supported someone with a workers' compensation claim? Are you coming to it from a different perspective? Are you a healthcare provider or something else? So if you could just briefly tell us a bit about yourself in the chat, then we'll know who we have on the call and we can try to sort of tailor that information as we go along to you. Thanks to those who've just joined us. We've just begun. I'm just giving a few introductions. So a couple more people jump on. And thanks again for coming. And we just ask people if they can use the chat function to ask any questions. And also just to briefly tell us a bit about yourself so we can try to tailor the information that we present today to you. So if you're someone who's had a workers' compensation claim, please say that. Or if you're a supporter of someone or a family or a friend, someone who's had a workers' compensation claim, or if you're coming at this from another perspective, please let us know that as well. Okay, so I'll get started and we'll just give you a bit of information about the study. This won't take too long, hopefully, and then we'll have some time for questions and answers and a bit of a discussion afterwards. Okay, so I assume you've come to us today because you've seen us release some information about this new project called Workers' Voice over the last couple of days. We sort of launched it earlier this week. It's the first time we've really spoken about the project publicly, but it's been a project that we've been developing for quite a long time, bringing together researchers with some people with lived experience of workers' compensation claims who've been helping us to design this, and then also seeking funding and getting it set up and doing all the ethical approvals and all of the research things that we need to do at the university to get this up and running, including getting ready for this launch, preparing the website and all of those sorts of things. So it's been in the wings for a long time, this project, and we're really pleased that we're able to talk about it now. The study, our objective is really to try to reimagine the way workers' compensation is designed and run in Australia, and to do that from the point of view of people who have lived experience of those systems, in particular, people who've made workers' compensation claims and their families and friends and supporters who've been with them through that journey on a workers' compensation claim. We think that perspective is really important, and that's what we want to bring out in this project. So our aims for the project are two, really. There's sort of two ways of saying the same thing. We want to try to design a workers' compensation system based on that lived experience of people who've made workers' compensation claims. And in doing that, what we're aiming to do is sort of create a vision for a kinder, fairer, better workers' compensation system in Australia. So that's what we're aiming to do. So I'll talk a bit about how we're going to do that and what that actually means as we go through. Okay, so first of all, why are we doing it? Well, we're doing this mainly because we think there's an opportunity to improve the way workers' compensation is run in Australia and to improve the health and return to work and other outcomes of people who are involved in workers' comp systems. We think that opportunity exists because many people, research over many years, ours and that of others, and just speaking to people in these systems, tells us that many people find workers' compensation confusing and stressful, and that stress can affect their health and their return to work. And particularly people's mental health is something that the research tells us can be affected by being involved in a workers' compensation scheme. Now, it's not everyone, of course, who feels that way, but a substantial proportion of people do report that stress and those consequences of that, and it can delay returns to work and have, in some cases, pretty serious long-term consequences for those people. We also know that good systems consider the views and experiences of people who use those systems. That's true in many different parts of life and many different parts of society, and it should be true in the way we design and run workers' compensation as well. And I guess we feel that workers haven't really had a very strong voice in the way that workers' compensation is designed and operated in Australia. And this project seeks to tap into that voice and amplify it as much as we can. So really we're doing this because we think the systems can be improved by listening to the voice of workers and including that in decision making. We'll do three things at a broad level. We'll actually do lots of things during this project, but three main things that we're going to do, because we don't like to break these projects into parts. And these are the three main parts of the project. Part one is we're going to listen to begin with, and we're going to do that in multiple ways. I'll talk to you a bit about how we're going to listen first, but really what we want to do is hear from people who've made workers' compensation claims and those people who have supported them through that process. And having done that and collected lots of information and data from and with those people, we're going to use that information to co-create what we're calling a computer model of workers' compensation based on that lived experience and based on all of that information we collect from people involved in part one. And the development of that computer model will be in partnership with people with lived experience. It's not something we're going to take away to the university and just do ourselves. We want to do that through a series of workshops where we co-create the model in a very interactive way. And then what we're going to do is compare that model that we developed based on lived experience with the current approach that we have towards workers' compensation in Australia, to see how it differs, to see if it produces better, worse, different, alternative sorts of outcomes. It's likely that we might actually end up creating a number of different models of workers' compensation based on the information that we get. Might not settle on one, so we might have a few different options to look at when we get towards that end comparison state. And the computer model is really just a simple way of saying what we're going to do is use the same sorts of approaches that we all became pretty familiar with during the lockdowns and the COVID pandemic in Australia to develop artificial systems on a computer that represent real things that occur in society. You'll have all gotten used to those predictions that we saw every day during the lockdowns where we were predicting how many cases there'd be in a month or how many people were going to be hospitalised. They're based on these technical models, the same sorts of things we're able to use to develop artificial or, if you like, virtual models of workers' compensation systems and to determine what outcomes they're likely to produce. So that's sort of what we're trying to do here when I talk about a computer model. And along the way, all the way through this process, we're going to promote the study findings as we go to decision makers and to people in the community. So when we get information from that first phase, when we're hearing from people with workers' compensation about their experience, about what impacts it have on them, we're going to turn that into study findings, which we will promote, communicate. We've got these computer models, we'll do the same thing. We'll start to talk about those and what they mean and what features they have. And then when we're in part three, when we're doing the comparison, we'll also talk about the findings there. And really one of our main aims here is to have a conversation with people who are in decision-making positions and other people involved in these workers' compensation systems to really amplify what we're hearing when we engage with people who've had workers' compensation claims. That's really a big aim of this project. Okay, so these are the people we want to hear from. This project is all about people who've had direct lived experience of workers' compensation systems. So we want to hear from people who have made a workers' compensation claim. and people who have supported those people through their workers' compensation claim, which might be family members or friends or other close connections who've played a supporting role while someone's been on workers' comp. They're the two main groups of people we hope to hear from and speak with during this project. There are a few ways that you can get involved if you fall into one of those two groups. At the moment, we have a website, so I'll talk a bit about in a minute. It's workersvoice.com.au. And if you go to that website, you can get involved in a number of different ways. We have a short online survey. You can just click the link to take you right through to that straight away. It takes about 10 or 15 minutes to complete and asks you some questions about you, about your workers' compensation claim, and about your experiences during that claim. Or if you're logging on as someone who's supported a person, it asks you a similar set of questions about you and your experiences in supporting someone during that claim. If you don't want to do that, or if you want to do additional things as well, there's other ways you can get involved. You can tell us about your experience. We have the ability on our website to accept people's written stories, or you can record a story on video or audio, or take some photos and send those things through to us in a confidential manner. We won't put them online without your prior permission. So we're interested in hearing directly people's experience as well. And if you look at our website, you'll already see some stories up there, both video and written stories. The third way to get involved is to ask us a question about workers' compensation. We know that a lot of people find workers' compensation processes a bit confusing, don't always have the information they might want to have when they begin a workers' compensation claim. And one of our other aims in the course of this project is to provide simple answers to some of those questions. We already have some answers on the website to some of those questions about what workers' compensation is and what benefits and services might be available to you if you make a claim. And we're hoping that by allowing people to ask us some questions, that'll sort of uncover some of the things that and information needs that people have when they're involved in workers' compensation. It's important for me to say here that we can't answer questions about your individual claim. That's not what we're here for. What we want to do is to be able to answer questions about the workers' compensation process or the way that workers' compensation systems operate. And then later on in the study, in not too distant future, we want to have some conversations and interviews with people who are involved who have had a workers' comp claim or support others. So, when you complete the survey, we're going to ask you if you're willing to be contacted for follow-up. And what we'd like to do there is select some people to participate in a conversation with the researcher where we try to get a more detailed, in-depth understanding of your experiences that we can use in developing these computer models. This is how you'll know what we're finding. So I talked a lot already about how we're going to promote the findings. We're going to do that in three main ways. So we'll do that through social media. We have a Facebook page set up, and we have our research group has some Twitter, or X, I should say, exposure, and we'll do it. So we'll put our findings out through social media. We'll do the usual thing that academic researchers like to do, and we'll write some reports and write some research articles, and we'll publish those. They'll be out in the public domain. And then probably the main avenue is through our study website. We'll post updates on findings and things to the study website. And that'll link both our reports and our social media activity and things together. So we've got three main ways we're going to tell people what we're finding and what we're doing. This is the team of people who are involved in the project. It's a big team. A project like this takes a lot of teamwork and a lot of people coming at this from a variety of backgrounds. Thanks to Elizabeth, who's with me today, Dr. Elizabeth Pritchard, who's part of the study team and has really been integral to getting this up and running. But you can see we've got lots of people involved. I won't go through them all in detail, but some researchers from Monash University, from researchers from the University of Melbourne and the University of Waterloo in Canada. And really importantly, we've got a couple of people here on our study team who have had workers' compensation claims or who have supported other people with workers' compensation claims. And we're looking to expand that exposure and that participation in our team as well. So it's a very diverse collaboration of people that have brought this together. Okay, it's important also for me to say this project is funded independent of any current workers' compensation government agencies or insurers. We want to make sure that this is an independent project. So one of the reasons it took us quite a while to get this off the ground is because we had to get some funding from the Australian Research Council through a research grant, which we secured towards the end of last year. And the project is conducted by this team of researchers at Monash University of Melbourne and University of Waterloo, working in collaboration with people who've had workers' compensation claims. So this is an independent research project. It's not something funded by any of the current regulators or insurers or other people or government agencies that have a vested interest in workers' compensation. We felt that's just important to emphasise. Here's a bit about the study website. You may have already looked at this. You probably have if you've signed up for these information sessions. It's workersvoice.com.au. You can also use this QR code if you have your phone in front of you to link. It'll take you straight through to the website. And that's my overview of the project. So that's a bit about what we're about and what we're aiming to do. I can see that we've had a few questions and things popped in the chat. I haven't looked at those yet. We'll just look at those as we go. I'll stop sharing.